Hello, everyone. My name is Christian Jose Plaza. My pronouns are he, him. I am a cisgender male. I am a family nurse practitioner located in Newburgh, New York, here in the Hudson Valley. My husband, who is a double board certified internal medicine and addiction medicine physician, and I own a primary care practice, Cross Valley Health and Medicine, located in Newburgh, New York. I have been working as a nurse practitioner since June of 2018, and my husband and I have founded the practice Cross Valley Health and Medicine in June of 2007. We take care of more than 8,500 lives. Our medical services include providing internal medicine, addiction medicine, and also providing care in inpatient hospital. We focus on many communities, one of which is our LGBTQ community. Currently, during this pandemic, we are providing telemedicine services for primary care services, and we also collaborate with Montefiore, with the Montefiore system in providing behavioral health services for management of depression and anxiety, also for bipolar disorder. So we do many different services, and especially during this critical time. So I was asked to speak a little bit about our experiences with COVID, and then some do's and don'ts currently about COVID to provide education and information for our LGBTQ community. Our experiences. Our experiences with COVID has been very much steep. We have learned so much in the last month, and I've had quite a journey addressing COVID, not only as a clinician but also as a patient. So in the last month, we have been providing COVID screenings for our patients who have manifested those classic symptoms that we have heard of so much about, which are the low-grade fever, the respiratory distress or the shortness of breath, and the coughing. But in the last month, we have also learned that there are other symptoms that patients can present from mild to moderate or even severe in many cases, which we have learned that not everyone has those classic symptoms and therefore still require screening. So many of those symptoms that we have learned in the last month have been lightheadedness, headaches, has been chest pain, back pain, has been rashes, loss of taste of sense, loss of taste or smell, or both. And so we have found that there are so many other symptoms that really require us to really keep monitor, because what we realize too is that when someone ends up becoming COVID positive, yes, many patients may have had mild symptoms, but we also have been taking care of patients that end up developing more moderate symptoms where the symptoms just does not go away after the 3-4 days. Some patients can experience low-grade fevers for up to weeks at a time, and others can develop more worsening respiratory distress, worsening shortness of breath, and we have to figure out how to best manage those patients in an outpatient setting, and when to determine, okay, many of our patients, when it's time that we need to take it up to the next level of care and require them to be hospitalized, when to send them to the emergency room. And so in this last month, it has been quite an experience. However, specific to the LGBTQ communities, there are so many gaps that we are not aware of. Of course, we're taking care of all of our patients, but we've come to realize that we have to make sure that we are addressing the needs of our community in particular. And so part of this dialogue that will start on a periodic basis is to not only inform our patients about taking care of patients that have COVID, but also understanding the needs of our LGBTQ community and what what gaps are there that may exist that we may not necessarily be aware of. And so part of this experience is to share what we've been going through as providers, and but also to learn from our community what are some needs that we necessarily haven't been focusing on that we should be addressing during this pandemic. As a patient, I ended up becoming COVID positive. That was March 30th. I'm on COVID day 21. And it has been a journey for me as a patient. I ended up having a more of a moderate case where I ended up being hospitalized myself for only 3 days. But in that process, it was a very anxious, provoking, very scary experience. And I can't explain how I was able to get better. There were so many variables that existed, that there were during that time period. But fortunately for me, I was able to improve, and and get better from it. I am still currently COVID positive. I just received screening. I just got back my repeat screening results today, and now I have to continue to isolate myself these next 2 weeks while still providing telemedicine services. But what does that mean to continue to have to be COVID positive? I mean, there's so many questions. And so we're all learning as we go, and it's been quite a journey. We also wanted to quickly address about like what are some things that we should be doing and what we shouldn't be doing. So first off, it's really important to establish a relationship with your primary care provider. Whether or not you have symptoms, it's really important to have that relationship, because if somewhere down the line there's exposure or you end up having these symptoms, it's really important to then be engaged with your primary care provider. It's something that, in my experience, I constantly promote and say, even if you are at the healthiest, you should have a relationship with your provider, because if you end up developing symptoms or you just want to learn more, it's always good to have that relationship with the primary care provider in an outpatient basis. Establishing a telemedicine appointment is not challenging, it's not difficult, and therefore, and also it's covered by many insurances. There's no co-pays, there's no there's nothing really that, as long as you have some kind of insurance, you are able to have these services at no cost. So taking advantage of the telemedicine component during this pandemic is extremely beneficial for many of, especially for our LGBTQ community. That should be occurring. And so if our LGBTQ community is not doing that, I encourage you that this is the best time to establish that relationship with your primary care provider and getting to know. For me as a family nurse practitioner, and of course for my husband, we welcome all of our patients, not only patients that are in our practice, but even new patients. And we've had new patients that have come in specifically to address their concerns with symptoms related to COVID, and making sure that we're taking care of them. So it's really important to have that established relationship with your primary care provider, and during this time, telemedicine is a great tool, a great service that will help establish that relationship. So I implore our LGBTQ community to doing that. I did write down some notes for myself. If there are symptoms, get screened. Okay. There's without a doubt. I mean, certainly, I think many of us want to be screened for it, but there's limited access to it. In our practice, we've like I've said in the beginning of this video, we've come to realize that there are many kinds of symptoms. So if you're not sure, or you have had symptoms that you've never experienced before, and there's some concern there, then definitely being screened is important. And so as long as there is a practice or provider that would be willing to do it, and in our case, if we have the swabs, we're not going to restrict patients from being screened. Then get it done, because the more knowledge you have, and the more informed you are, the better that you can take care of yourself, and the better that we can manage manage your care. Of course, there's also anxiety and depression associated with COVID. You may not necessarily have to have symptoms, but we also have patients who are extremely anxious, extremely depressed, that are not able to concentrate, handle their day-to-day tasks, or adjust to the current situation during this pandemic, or not able to complete their work or academic work. And so again, having that established care or established relationship with your primary care provider is really important, because we want to advocate for you during this stressful period. And also, I can only speak for our practice, but also we have a team who is ready to able to take care of patients that are experiencing anxiety and depression during this particular pandemic. And so patients, or if there's someone out there in the LGBTQ community that is anxious or depressed, or just not adjusting well to this pandemic, I implore you to establish a relationship with a primary care provider. Certainly establishing a relationship with us, because we want to address those concerns and those needs. Some don't disregard your body, and if you're having symptoms, certainly you want to address it. You don't want to avoid it, because as we know that even though 80% of the population may not experience moderate to severe symptoms of COVID, but what we learned is that for whatever reason, on average after a week, days 7, 8, 9, 10, for whatever reason, some people can potentially deteriorate. So don't ignore your body if you're experiencing symptoms that you have not experienced before, particularly the low-grade fever. Low-grade fever can immediately turn into high-grade fever, causing a whole chain of reaction that if we can try to manage beforehand, will help improve, have a better outcome. Ignoring social distance. This is something that we're very much concerned about because of our current political climate that we're in, where we are eager to go back and have some kind of normalcy. However, for us as providers, we're very much concerned, and so we're very much going to say, do not ignore social distancing. Do not ignore wearing these masks when you are encountering with other people that you have not had in contact with, that are not from your household. It is so important. This virus can easily spread to one person to another. So wearing the mask, me being COVID positive, I'm right now in an isolated room that I'm going to be spraying down with Lysol. But as soon as I step out, I'm going to be wearing the mask. I'm going to be spraying the room here with Lysol to help reduce the risk of transmission. And that's here within my own household. So don't ignore it. Don't ignore social distancing and practices to help prevent transmission or contracting COVID-19. So please. And I think that's pretty much it. It's really important to be informed about COVID-19. So certainly the CDC website has quite a bit of information, and I look forward to having these periodic information. I believe we're going to be collaborating with other providers and also having Q&A sessions to learn more about what are the needs, what are the questions that our LGBTQ community has. And I really am much looking forward to having this opportunity and engaging with our community. And I hope that this 15-minute video has been informative for you. All right. Well, thank you so much, and have a very good week. I look forward to engaging more. Thank you.